A new school year brings new teachers, new friends, and updates to your child's health forms and vaccines. Vaccines protect kids from serious illnesses and are often required for school. However, if you have questions about how vaccines work or their safety, then you're not alone. That's why it's important to talk with your doctor to make sure you are getting the facts, as there is a large amount of misinformation. It's important to know what a vaccine is, what it does, and who decides when it should be given. Most vaccines use a small, safe dose of a part of a virus or bacteria to train your body's immune system to fight off the real thing before your child ever gets sick. It's like a practice drill for the immune system. The vaccine does not incorporate into your DNA. The guidelines for vaccines, like when to get them and how many are needed, are made by medical experts. The American Academy of Pediatrics reviews the science in large national studies every year to make sure the vaccine schedule is safe and protects children at the ages when they need it most. Vaccine companies do not decide if a vaccine will be recommended, nor set the guidelines for when they are given. That decision is made by public health and medical experts based on good science, not profit. Vaccines are one of the best ways to keep kids healthy. They help protect your child and other people in your community, like the elderly or immunocompromised, from serious diseases. This was especially important and effective during COVID-19. Sometimes, misinformation sounds true, especially when it aligns with what we want to believe or we're worried about protecting our children. But the truth is, false health advice is like being told to drive through a storm with your child in the car. Taking the wrong advice, no matter how reassuring it sounds, can lead to real harm. That's why it's important to rely on trusted, science-based sources like your doctor.
Hi Doc, I heard some things about vaccines that worry me. Can we talk about them?
Caring for your child means asking questions. Let's go through them together.
Aren't there natural methods to make my child immune? I thought breastfeeding would be more protection.
Getting sick from an infection can be very dangerous. Some illnesses, like measles or whooping cough, can lead to severe breathing issues that land children in the hospital. Vaccines teach the body how to fight germs before we meet them. Breastfeeding helps give babies temporary immunity because it doesn't last forever, or protect them from most diseases the way vaccines can. The American Academy of Pediatrics updates its recommended vaccine schedule yearly, which is detailed here.
It sounds like vaccines help the immune system prepare before the germ can hurt you. But isn't this too many vaccines for my child to have at once?
Think about all the germs children fight off from their food, toys they share, and the classrooms they enter. Vaccines help to prevent the most dangerous germs from harming your body. The Institute of Medicine reports that there is no evidence that the vaccine schedule is unsafe. It's best to avoid delaying or separating out the doses more than the schedule recommends, because this can reduce how effectively the vaccine works. This delays protection during the recommended age group in which the germ is more likely to infect or have worse outcomes. This also adds more doctor visits for vaccines.
I've heard that vaccines can cause health problems like autism, fertility issues, and autoimmune disorders. Is that true?
No, these false claims have been disproven by very high-quality, large population scientific studies. Parents are encouraged to read reports written by the National Academy of Medicine, which explain that there is no link between vaccines and these health conditions. To find these reports, search National Academy of Medicine, vaccines, and blank, based on what information you'd like to know. It's a good rule of thumb to use accredited websites, such as those ending in .edu or .org, to ensure the information is trustworthy and evidence-based. Be cautious of opinion pieces, personal blogs, tweets, or advice from people who aren't confirmed medical professionals. It's important to remember that infections, especially in unvaccinated people, can weaken your immune system. This puts you at greater risk for other severe health problems, such as pneumonia, cancer, lung disease, lung failure, or other additional infections.
Are there any dangerous chemicals or metals in vaccines like mercury?
Since the early 2000s, mercury has been removed from vaccines. The small amount of aluminum used helps to boost the immune response. It is similar to the amount that babies ingest through breastfeeding. Vaccines do not contain microchips or hidden ingredients. Some were developed using fetal cell lines, but they do not contain fetal cells or DNA. Most major religions support vaccination, recognizing its role in public health.
If these diseases are mostly gone, why does my child still need a vaccine?
Even though the diseases are less common because most people are vaccinated, the viruses and bacteria that cause them still exist. Outbreaks can occur when people are exposed to the germ. This can cause severe health problems for the unvaccinated, making vaccines very important.
That makes a lot of sense. This really helped answer my questions. I'm ready to have my child receive their vaccines.
It's okay to ask questions. Vaccines are safe, protect your family, and keep our schools and communities healthy.